Today we're going to study cytotoxic drugs, and I'm really excited because now we're studying drugs that will destroy cells, because usually we're just trying to repair the cells. So what cytotoxic drugs do, they destroy the cells. And why are we going to destroy the cells? Because to treat malignant diseases like cancer and stuff like that, like we say a normal cell in 1 minute, just for example, is going to divide into 2, but a cancerous malignant cell in 1 minute it can divide into 4 or 6 cells, and it's just going to keep on dividing rapidly, and we need to stop it and just destroy it, put a stop to it. Now in a cell, a cell is going to undergo different phases, and these phases we can term them as a cell cycle. Now we can look into the phases. First phase is known as G1, and what happens during this phase, that different enzymes are going to be formed in this phase. Now in the second phase is known as S phase, and DNA synthesis is going to take place. Now in the third phase is G2 phase, and during this phase synthesis of protein is going to take place. And in the fourth phase is M phase, and what happens in here is cell division or mitosis is going to take place. So we have the G1 phase, enzyme synthesis, the S phase, DNA synthesis, the G2 phase is the protein synthesis, and the M phase is going to be the cell division. Now we have two types of cytotoxic drugs. Cytotoxic drugs are going to be divided into two main groups. It's going to be cell cycle non-specific drugs and cell cycle specific drugs. So cell cycle non-specific drugs, as the name indicates, is going to act on both the dividing cells and the resting cells. It's just going to go in there and it's going to destroy everything. And the cell cycle specific drugs is only going to act on the dividing cells. It won't say anything to the resting cells. It won't even care about them. So it's only going to act on the dividing cells. Now the drug that we have in cytotoxic drugs is Methotrexate. And Methotrexate is an antagonist of folic acid. And folic acid is just a part of our daily life. We take it like iron, we take in a lot of food that we use daily. So the chemical structure of Methotrexate is similar to folic acid. And Methotrexate, we can give it orally, we can give it intravenously, and is excreted by the kidneys. And 50% of the drug is bound to the plasma proteins. Now, some of the drugs, different drugs, they can cause toxicity. Now, how are they going to cause toxicity? They're going to displace the plasma-bound Methotrexate. And the drugs such as phenytoin and salicylates and sulfonamides and tetracycline and chloramphenicol, just don't take them with Methotrexate because they're going to increase the toxicity. Now, mechanism of action, what we have over here is folic acid, and we have an enzyme dihydrofolate reductase. Now, what does dihydrofolate reductase do? It converts the dihydrofolate into tetrahydrofolate. So what Methotrexate comes and does is going to just stop the production of dihydrofolate reductase, the enzyme. So we can't convert dihydrofolate into tetrahydrofolate. Why? Because this tetrahydrofolate, it causes DNA synthesis. It gives rise to a number of coenzymes, right, that are used in the production of DNA synthesis. So Methotrexate, what it's going to do is going to completely just block that enzyme, and then there will be no tetrahydrofolate, and there's going to be no DNA synthesis. And if there's no DNA synthesis, there's going to be no new cells and no cell division. They can't divide then. But there's only one problem over here, that resistance to Methotrexate is going to occur rapidly. So resistance is going to develop a lot. So what can be in resistance is Methotrexate, it won't be transported along the cells. It won't be transported across the cells. And what else can happen is dihydrofolate reductase is going to produce in a large number. Like Methotrexate won't be able to stop it. There are going to be so many dihydroreductase all over the place. And what else can happen is the cell, they're going to be a bit tricky, and they're going to produce different type of dihydrofolate reductase. They're just going to change the structure a little, and Methotrexate, it can't act on them. It has lower affinity for Methotrexate that way. So in this case, we're going to use a technique which is known as Leucovorin rescue. It was Leucovorin rescue, right? I'm just tired of keep on talking and talking. And so what we do in this is folic acid. We're going to use it with high doses of methotrexate. And what does folinic acid do? It acts on the normal cells, because only normal cells can utilize folinic acid to synthesize nucleic acids, and malignant cells, they can't even use folinic acid. And folinic acid, what it does is going to provide protection to the normal cells and to the cytotoxic action of methotrexate. I know I sound so bookish at the moment. And then every drug, we know it has adverse effects and has indications, it has good effects. So let's just go to the good effects before that, before the adverse effects. So in indications, what do we use methotrexate for? It's used in tumor of trophoblast, it's used in leukemias of children, acute leukemias, and in lymphomas and carcinomas of breast, ovary, and colon. Now, on the side effects, what its major side effect is, it can cause bone marrow depression with leukopenia and thrombocytopenia. So it's going to cause bone marrow depression, and then we have gastrointestinal toxicity. And how we'll find about the gastrointestinal toxicity is it's going to form oral ulcers, and it can cause diarrhea. So when you have oral ulcers and you have diarrhea, you know it's gastrointestinal toxicity, and it's nausea, and it's alopecia and dermatitis, and it's going to be, that's going to be when you take high doses of methotrexate. And obviously in high doses it can cause renal toxicity, and it can cause allergic pneumonitis, and in serious conditions, like it can lead to serious conditions sometimes. That's every drug. And that's all it was. That's all it is about cytotoxic drugs for today. There are lots of drugs in here, but I just don't think I can keep up with it in one video. So anyway, thanks for watching, God. And don't forget to follow or subscribe. That's if you like it, you can just click the red subscribe button in the corner. And you can always get to chat to me on Facebook on my page. And don't forget to just like, follow, and share.